Thank you very much for having me tonight. So let us begin. I'm here, as you heard, to talk about Delaware's paid leave insurance program. We have a little agenda here for you. We're going to start with an overview of the program. Each of you as healthcare professionals, many of you with your own practices, are not only going to be involved in this program through the main thing that we're going to be talking about, which is the Certificate of Serious Health Condition, but you're also employers in the state of Delaware who may be required to follow this program. And if you're in an organization that provides these benefits to their employees, you would be an employee of this program, and therefore you'd be eligible for claims yourself. So you're all sort of very much wrapped up in this program, and I hope you get a good overview of the whole program as an entirety. We're also going to be looking at the Delaware LaborFirst, which is our computer system, the functions that it currently performs, and how we're going to be improving it with our new launch on January 1st. And then we're going to focus in on the newest part of our program, which is starting January 1st, which is the claims process, and most importantly for the people on this call, the Certificate of Serious Health Condition. And then we'll open it up for questions. So let's get started. So just to get started here, Delaware Paid Leave is the name of the program itself. The official name is the Paid Family Medical Leave Insurance Program. That's a mouthful, so we just reduced it down to Delaware Paid Leave. And that is the program writ whole. We also have our online shared administrative system, which we call Delaware LaborFirst. And that is going to be involving all users in the program, our participants, employers, third-party administrators such as Paylocity and ADP who help you with your payroll, claimants and paid leave staff, and of course, healthcare providers. So the most important thing about paid leave is it's not a single thing. It is 4 different types of leave together in one bundle of coverage. The first one is parental leave, which is a lot like maternity leave, the old-fashioned maternity leave. There's also medical leave, which most of you would recognize as a form of short-term disability. And then we have 2 unique coverages, family caregiver leave, for which there is no insurance policies in the state of Delaware until this program was started. And that's for employees helping their parents, helping their children, helping their spouses when they have serious conditions, and also qualified exigency, which is an awfully strange name. And it comes from FMLA. I'm sure you're probably aware FMLA is the Family Medical Leave Act. It's been around since 1993. We follow much of the regulations. We're mirrored and based off of FMLA. And qualified exigency refers to the type of leave where employees who have loved ones who are sent overseas on military assignments are able to take care of issues on the home. Employees can be able to receive up to 12 weeks of paid leave under FMLA, and that is the maximum amount of leave that you can take under paid leave. Employers can choose more coverage than what's included in the minimum requirements of Delaware's paid leave program. So as you may recall, parental leave is for healthy parents bonding with their healthy children. If there is a medical-related illness or injury arising from pregnancy or delivery, that would be paid under the medical leave or, in other instances, short-term disability program. So bonding leave is what we really call parental leave. And that's one of the programs, one of the types of leave that you can take all 12 weeks for that one qualifying event, having a child and bonding with them. You can also use this not just for birth, but also for adopting and fostering a child. Next, please. Qualified exigency is when employees who have loved ones serving on overseas military assignment, they can stay home and they can take care of the issues homeside. And this is the first of the 3 types of leave where there's a separate type of maximum, and that's 6 weeks every 2 years, every 2 application years, if you know FMLA lingo. And that program is not widely used, although it's widely understood by those in the military community. Next, please.
Apologies, Chris, just a slight delay.
That's all right. Medical leave, as I said, is a lot like short-term disability, which is one of the more widely available types of leave provided to insurance provided by employers to their employees. It is also another up to 6 weeks for every 2 years, and it's for when the employee themselves has a serious health condition. And also, mental illness conditions are treated as any other illness. So if they qualify under FMLA as a serious health condition, then they will be covered under paid leave as well. And finally, family caregiver leave. This is one of the newest forms of coverage. Again, 6 weeks every 2 years to care for a family member with a serious illness or injury. That includes a child, a spouse, or a parent. We follow FMLA, so there's some limitations and some benefits from following FMLA. One of the great things about following FMLA is it's been around since '93. It's something that's well understood in the community. There's plenty of information out there on the internet and through consultants to help you understand how FMLA works. But one of the limitations is child, spouse, or parent. It does not include some certain types of family members, such as siblings. If you have an older sibling and they're in ill health, FMLA doesn't cover it, and unfortunately, neither does paid family medical leave as well. And parents are covered, but not parent-in-laws. So that's a limitation of the program. The reason why we do this is because the goal of the program is to really basically overlap almost completely with how FMLA is transacted, so that employers and employees can understand the program a little better. Next slide, please. So business requirements, which employers are required to provide what coverages. First of all, you have to have more than 10 employees. If you have fewer than 9 employees, you're exempt. And when we're talking about employees, what we're talking about is employees who are Delaware based. We only count employees who work primarily in the state of Delaware, which we define as 60% of the time, 60% of their time working at home. It also means that federal employees are exempt. The federal government has their own program similar to paid leave, and that's the program that they're under. And also, railroad workers, Amtrak, would be covered by the National Railroad Act provisions as well. And in Delaware, we have a unique provision compared to the other 13 states that provide mandatory paid family medical leave to their citizens. It's that seasonal operations that shut down for a month in a row. Think Funland down at the beaches. They're exempt from this program entirely. So that's some of the companies. If you're not one of those, think of all the companies that are usually excluded under employee benefits. Government agencies, state, county, or municipal, those are all included in Delaware paid leave. Faith-based organizations, religious organizations, and nonprofits. If they have 10 or more employees, then they are required to participate in Delaware paid leave. However, if you have between 10 and 24 employees as an employer, you're only required to provide parental leave to your employees. You may, if you wish, just like if you have 9 or fewer employees, voluntarily enroll in Delaware paid leave. And why would you want to do that if you were an employer? It's because we will provide these coverages to your employees at the same terms and same conditions and the same rates as the larger companies, which puts you on an even footing in case over time we believe this program will be something that employees will be looking for when deciding between employers. And so small businesses will be able to participate. They're not required to, but they can participate in some or all of this program. If you have 25 or more employees, that's when you're required to have the full range of paid family medical leave coverages. Next slide, please. So who are the eligible employees? First of all, they have to work for an employer who falls under the mandate. Again, no federal employees, no seasonal employers, at least 10 eligible employees. That does include all your government employees below the level of federal, nonprofits, religious organizations. Those are all included in eligible employers. They have to work primarily in the state of Delaware. Again, that's 60%. Now, if you think about in a world where there's a lot of telecommuting, there's a lot of work from home. If the employee lives outside of the great state of Delaware. Now, why would they want to do that? I'm not sure. But if they live in Pennsylvania or Maryland or New Jersey, they can do it. If they work from home 2 days a week, that means they're required to be part of this program, because that means the other 3 days a week they're in Delaware, and they're therefore working 60% of their time in the great state of Delaware. If they work 3 days a week at home in another state, then they're actually below that 60% threshold and they're not included in this program. In case you're interested, New Jersey since 1948 has had a similar program since to paid family medical leaves called temporary disability insurance, and Maryland and nearby DC are both starting up their, well, both DC has had a program for quite some time, and Maryland will be starting their paid family medical leave insurance program shortly. And then these last 2 bullet items are much like FMLA's requirement. Again, we try to make it so that if an employee is eligible for FMLA, they will also be eligible for paid leave, which means the opposite. If they're not eligible for FMLA, they won't be eligible for paid leave. So in order to qualify for paid for FMLA, you have to work for your employer for the last 12 months. You also, in the most recent 12 months, have had to have worked at least 1,250 hours a year in that 12 months, which comes out to roughly 25 hours per week, which if you're working in most 8-hour day jobs, that's at least 3 shifts. If you work more than 3 shifts, then you qualify for this program. If an employee is approved, if they're eligible and their claim is approved, they will receive a benefit of 80% of their normal weekly wages, up to a maximum of $900 a week. What that means is roughly at $52,800. If you make that $52,800 a year or more, you will have basically $900 a week check. If you make less than that amount, you will get 80% of your normal weekly benefits. We define wages on FICA, which is nearly the same as full gross benefits. It does not include Section 125 cafeteria plans, but it does include bonuses, commissions, and tips. So it is a broad form of a definition of income. As this program is not backed by federal law, it's only in 14 jurisdictions around the country, and there are no federal laws that govern it. So we're only allowed to tax ask for contributions from. And by ask, I mean mandate. We're only allowed to mandate that employees and employers pay on their Delaware FICA taxes. So that creates a limited definition. If you work with a third-party administrator, a payroll company such as ADP or Paylocity, our rules are built into their system. They will help you understand which of the which income to use and which to exclude. If you use HR software program like PeopleSoft or Intuit's QuickBooks or Gusto, again, we've also built our program into their rules, so it'll be an easier process to send in the required contributions and hour and wage reports. But basically, the Delaware state income tax wage base is your guide of what is the eligible income. And income is used both to define contributions into the program, premiums, taxes by another name, and benefits. So it would be the 80% of their FICA Delaware wages. Next slide, please. So as we've discussed, Delaware LaborFirst is our administrative online system. To this date, starting on January 1st of 2025, that is when employers were required to start sending in contributions based upon their employees' pay. And the portions of the modules of Delaware LaborFirst that are currently in force, that are active and can be used by all participants are those that relate to contributions, which is registering your company, which is enrolling your employees, providing waivers for your employees, which is a wonderful program. You can learn more about that on our website or on other videos that we have on our website. It helps employers save money. And waivers are done through Delaware LaborFirst, and then it'll produce your quarterly hour and wage report, and it will tell you through an invoice what your required contributions are. You pay your program contributions through Delaware LaborFirst, and all the accounting is done through Delaware LaborFirst. What is going to happen next on December 29th, we are going live, and on January 1st in the brand new year, when you wake up, the system will be available for the public to start making claims. So the claim system begins on 1/1/26. Next slide. So there's two important things. First, I want to go over just a general overview of how the claims process works, again, because you're going to be both employers and potential claimants. So we'll start with that, and then we'll move into the crux of this, which is the most important part for you as providers, is the certificate of serious health condition. Next slide. So this is a general overview of how the claims process will work. During the year, employers, sometimes through their payroll companies such as ADP or Paylocity, or through their HR software, will send in quarterly hour and wage reports that provide information about all of your employees, including their Social Security number. And when an employee has a claim, potential claim, they come to our website, they enter into Delaware LaborFirst, and they enter their Social Security number. That Social Security number will be matched to their employer. They might actually have a couple of employers, especially if you're, say, a restaurant, and you have some people who work a couple of shifts a weekend or at night. You may be their second job. Both employers will be on the system, and we treat each claim separately. Each employer is responsible for the information that they have, not the other employer. So you just have to worry about your own information. So the employee enters their Social Security number, they find their employer, they're matched. The employee then goes through a series of questions that leads them into a claim form. that is specialized towards each of the 4 types of leave. And they basically answer all the questions about themselves, about the patient, either themselves or their loved one, or their overseas military service, or the birth of their child. And then they hit submit, and the form is entered into our system. Now, the important thing to know about Delaware Paid Leave, it is an almost entirely paperless system. There are no claims forms. There are only input screens. So you come into our system, you fill out the information. The data fields make sure that you put in the correct type of information. You can't put in free text into a field that asks you for a calendar date. You have to enter into a calendar date. If the system needs a number, you can't put in alpha, you can't put in alphabetic alpha text. So it's smart in that it makes sure that you filled it out correctly and you filled it out completely, or else it simply won't accept your claim. And the claim comes in, there's no claims that get lost in the mail or in HR. They come directly into the system and are consumed and available to everybody else who's available and has permission to see that information. So it makes it a much more efficient, a much speedier system. So the employee enters their information into the system, they hit submit, instantly it's transmitted over to the employer. The employer gets an email that says you have a new claim waiting for you in our system. They enter into the system and they review the information provided by the employee. And they also provide additional information that only employees would know, or employers would know, such as, does this employee still work for this company? Or were they fired yesterday? Is this a work-related illness or injury? In which case, it would be a workers' compensation claim, not a paid leave claim. So that kind of information is added in by the employer. If it is a medical or a family caregiver claim, those can only be approved if they're serious health conditions. And the definition for serious health condition that we use in our program is the same that FMLA has been using since 1993. So what will happen is the employee, and just as a side note, as a claim goes through the system, any claim that is deemed ineligible is sent a denial letter. And therefore, doctors won't be asked to provide a approval for a claim that's already known to be ineligible. So if the doctor receives a certificate of serious condition, it's because the claim to the date so far, in the process so far, has still remained active, and potentially that claim could get a benefit paid on it. At this point, the only paper piece of the system is that the employee will receive an email from us that they'll print out, or if you're the kind of doctor that gives out your email address, they can send that email, forward that email to you, which again is up to you as the provider. And then you could use the blue links to instantly go into our system. Otherwise, you'd be able to get a piece of paper which will be submitted just like a school medical review form questionnaire, sort of in your usual intake process, is the employee would give that to you, and then you'd take that, you'd use the form to access our system, and that form would also have a unique number that would give you the claim for that employee. That claim would be pre-filled with all the information we know about the employee, the patient, and the claim so far, meaning that you don't have to go through and handwrite all that information onto a paper form. It'll be instantly provided by our system. And then you will be asked only a handful of questions, which we'll get to on the next slide. And if you approve the claim, then you hit submit, and it'll be instantly sent over to the employer. The employer will make one final check to see if the claim they believe ought to be paid. And if they deny the claim, or if they approve the claim, the system will send out either an approval letter or a denial letter, not with the employer's name on it, but rather the Division of Paid Leave. It'll actually be underneath my name as the director of the Division of Paid Leave. If they're denied, there will be instructions on basically making an appeal. The first layer of appeal is they go to the Division of Paid Leave and they ask for a claim review. We'll go through, ask for any additional information, look over the system, make sure that the employer and the system manage the claim process correctly. We can approve it or deny it. Once we, as the Division of Paid Leave, approve or deny it, that becomes the official sort of final resolution to the claim. And if there's any appeal or court hearing thereafter, it would be the Division of Paid Leave defending our decision, not the employer. The employer is not liable for any decision made earlier in the process, because we as the Division of Paid Leave become the sort of authority whose decision is being discussed. So again, we could deny it, and in denying it, they get online instructions about how to ask for an appeal. A 3-member independent board appointed by the governor reviews it, and they issue their decision. If the employee still doesn't like what they hear, in other words, they've still been denied, they can go to the Delaware courts, which is, again, we as the Division of Paid Leave will be the defendant, not the employer. If at anywhere along the line that denial was overturned and changed into an approval letter will be issued, and the benefit amount will be calculated, and we will start paying out the benefit for to go to the employer. I'm sorry, to the employee. The employer is responsible for, once the leave is approved, for turning off the paycheck of that employee so they don't get basically double dipped, so that they just get the benefit check. And then the employer can use that cash flow to hire a temp while the employee is out on approved leave. Next slide, please. Now, as healthcare professionals, this is the piece that is most important to you, the patient, the doctor's approval for the patient's health condition. Next slide. So the certificate of serious health condition, as I said, it's going to start out, it's the only part that is paper. It starts out with a piece of paper arriving at your office. That piece of paper will have a link code to get to us into our system. And it will also have a unique code. It's our access form. You type in that unique code, and either the healthcare provider, the doctor, or their staff can enter the information. And the information is 3 questions. Does this illness or injury meet FMLA's definition of a serious health condition? Again, it's the definition that's been around since 1993. Hopefully by now, you're comfortable with making the decision about whether or not a diagnosis is a particular illness or injury is a serious health condition according to FMLA. After you decide that, if you say no, the claim is denied, and that's the only question you have to answer, because only serious health conditions according to FMLA are paid out under this program. If you do say that it meets the definition of a serious health condition, the next question will be, how many weeks should the employee take off, either to take care of their own medical needs or to help their family member be able to get to the position where they can do the everyday activities of living. And so how many weeks does that mean? You can say how many weeks you have. Our business rules within Delaware LaborFirst know how many weeks are available to that employee and won't provide them any more leave under our program, but they can take more leave under FMLA. But our system will advise the employer of that as well. And then finally, if they, once you say how many weeks they should take off, we'll ask you if they qualify for a reduced schedule. As you know, that just like an FMLA, they can either take days some days off, or a reduced number of hours, and that's a reduced schedule, or intermittent leave, which is the, say for instance, you have a patient who has chronic migraines. They can take a day off here or there when they have a migraine flare up. The most important thing is that there is no place where we ask you for any private medical information. There is no request of diagnosis codes. There's no request for medical information of any type. And there's no place for you to upload it. If you wanted to give us an EKG, there's no place to upload an EKG from this form. The idea here is that if this is something that is not HIPAA, falls outside of HIPAA, a lot of employers who have 50 or more employees have professional HR staffs who are used to handling private medical information, confidential information. Many small employers don't have an HR staff. They have whoever drew the short straw. And that person may not understand how to handle private information. And we didn't want to put them in the position where they'd have private information. So we just simply didn't make it possible for them to see any private information. Next slide, please. The way the system will work, again, you'll get your form, you'll come into our system, and you'll type in the form ID, that multi-digit unique code. Next slide. You'll be informed what kind of information you have at hand. This is the kind of information that you probably have at your fingertips when you're usually doing an FMLA request, and it's basically the patient's medical files. Next slide. The first piece of information is about you. The patient is going to provide some information. We're going to make sure, you're going to make sure that it's correct. Eventually, not right away, but eventually as the system improves after January 1st, there's going to be a unique ability, well, not a unique, there's going to be the ability for each healthcare provider to register in our system and do this health provider information thing only once. So you don't have to keep on typing in the information. That will be coming as soon as we, administratively possible, as soon as we get to it, which will be very soon, hopefully. And you will also put in bank information, because part of this is incentivizing the quick submission of these, quick completion and submission of these certificate of serious healthcare forms. If you complete a form within 10 days, you'll receive $20. Not much, but hopefully there's going to be a lot of these forms, not too many of these forms, but enough so that $20 is a nice little incentive. And if you complete it within 30 days, it'll be a $10 deposit into your bank account. So we'll ask for some bank account information, but not yet. At this point, there's no incentivized fee structure that will be coming down the pike. But at this point, the most important part of this is the NPI, the National Provider Information Number, which is a number you've been supplying whenever you want a payment out of Medicare or Medicaid. And the NPI is unique to you, and it has to match your first name, last name as it's written in the NPI system. So just make sure you type in the name as you usually type it into any NPI system. And that is our main way of verifying that you are you. Of course, that's publicly provided information. One of the improvements that we are working on after the system is unveiled in January 1 is we're going to be working with Epic, the massive medical information system, because we're going to be sending these forms through Epic's communication system, which means it'll go directly into your inbox on the platform that you use every day. And for us, we'll have the benefit of leveraging Epic's that pre-certification process, that you are a doctor that they know. So you're already vetted, and so that'll be a great way to reduce fraud in the system. And for right now, we're using NPI, and we're following up with some basically phone calls to make sure that you're a real practice. You might get a surprise phone call from the Division of Paid Leave. And then we'll ask for your business address and phone number so that we can get in touch with you. Next slide, please. This patient information, as I said, will be pre-filled for you, so you don't have to look through forms. As I was told by many doctors when we were talking about how to build this system, that you get a paper form, it has a sticky on it with the patient's name and information, and then the sticky is just, it falls off of it. And then you have no idea who that claim form belongs to. As soon as you put in that unique claim form number, this information pre-fills for you, and you know who you're dealing with. Next slide. And then this begins the process of the questions that we were discussing. Is this a serious health condition? First of all, is this, to your knowledge, a workers' compensation claim? You may or may not know this. Really, this is the employer's task to know, but you may know. And if you do know, put that information in there. Put in the information of the date of the inception date of the medical condition. And if there's a leave ending date, that's where you would put that in. When do you expect the illness or injury to end? Of course, that last number, that last date is the tricky one, and it is something that you have some ability to adjust the numbers. This is the closest we get to private personal medical information. These are the several different categories that FMLA uses to break down what kind of medical claim it is. Inpatient care, incapacity plus treatment, so on and so forth. And that just basically helps us administer the claim. Next, please. And the next step is this claim actually medically necessary? And that's where does it meet the serious health condition requirement of FMLA? And then you can enter in the leave schedule, how many weeks they should get. Now, most of these claims will be done on a continuous leave basis. However, if you wish to, you can have, say, 2 weeks of continuous leave, 2 weeks of reduced leave, and 2 more weeks, 10 more days of intermittent leave. And our system will allow those 3 different types of leave to be used by the patient. Next slide, please. And these are the different leave schedules. You probably know these by heart now. Continuous, starting in on one day, ending on another day. You don't show up for work in between. Intermittent is for that chronic migraine, those kinds of random days when the medical event is needed. Or it could also be a scheduled days, although that's probably better left through the reduced schedule. Reduced schedule, again, could be certain days per week. If you had physical therapy twice a week and you knew that it was always on a Tuesday and a Thursday, that would be a reduced schedule. If you didn't know what days of the week it was, you would probably use intermittent. We'll have some advice on how best to approach that. And you can do it 2 different ways for reduced schedule: the reduced number of days per week or the reduced number of hours per week, in which case, both cases, we don't care what the work schedule is. We don't care if it's a Tuesday, Thursday they have off or a Monday, Friday they have off. We just want to know they have 2 days off per week. And if it's a reduced hour schedule, we don't care if they should go in the mornings but not the evenings, or vice versa. We only care that it's a half schedule. They only go in for half of their normal hours. And our system will ask you that information and provide you a place to put that in. Next slide. At the end, you'll get a summary screen that basically shows you everything that you've entered into the system. Next, so we've kind of focused in on the part of the screen that you'll want to focus on. Next to every screen, there's what we call the delivery menu. If you've ever ordered from Domino's, that it's the order taken, being prepared in the oven, ready for delivery, same kind of process on the side, so that if you have a piece of information that you want to go back and edit, you just click on the screen where you put it in. or you can just hit the back button and go back. But you can go back directly to the screen you're looking for using the pizza menu over on the side. But if not, you click on the box that says, I swear, back stack of Bibles or whatever, that this is accurate information to the best of my knowledge. And then you electronically sign your name, you date it, and then you hit next, and it is, if you hit it is submitted. That is the entire process. I took much longer explaining it than hopefully it will take to actually do it. And you can save this information and keep it on your records. You'll also be able to access, once the health care professional portal is available, you'll be able to get a copy of this anytime you want, as soon as that portal is created. But for now, you might want to, do a print screen, save it, and keep it in your system just in case. Next slide. Just so you know, we're always available for you. Our system puts a lot of administrative requirements on employers and on healthcare providers. And so we know that we need to, almost half of our staff are focused on helping our users, whether that be the employees, the employers, or healthcare providers. That phone number is a call center. It's 365, 24/7. On Christmas Eve, it may not be the best people on the line, but there's going to be somebody there to answer your call. Even on Thanksgiving, there'll be somebody there answering your call. Again, might not be the best person. The people who answer the calls on the front lines of answering the calls will basically give you the information that's available in our FAQs, plus a little bit more information, but they won't be able to help you if it involves confidential information. They haven't gone through background checks. We don't give them that confidential access to confidential information. If it's a confidential question or deals with a very fact-based situation, it will be forwarded to my team here at the Division of Paid Leave, and will respond usually within the next morning. There's also an email address, pfml@delaware.gov. We've also recently created PFML claims at Delaware Gov, so that we can help employees and employers with claims issues. And then those are our two websites. Again, really the paid leave is the main one, and the two talk to each other. Next slide, please. That's it. I am here for any questions if you have.
Chris, you did a great job. Thank you for taking and organizing that well and making it easy to understand. So appreciate it.
That was mainly Ryan, who's been flipping the slides for me.
Strong work. Thank you. Lynn, you want to take over for the chat?
Sure. First question, how might the new Delaware paid leave requirements uniquely impact physician practices, especially those with a mix of full-time and part-time and contracted clinicians?
So, as an employer, this is more directed to you as employers. So contracted employees are not part, you have to get a W-2 in order to be an employee. Most 1099 employees are either independent contractors, in which case they're basically their own boss, and they can voluntarily enroll in this as a voluntary employment by an employer who's a sole practitioner, as a single employee employer. They have their own process to do that, but that would not be the responsibility of the practice. If they receive a W-2, that who gets it. Also, partners who get, I believe it's called a K-1 instead of a W-2, they are also not part of this program. It is just W-2 employees. The other side of that is part-time workers are included in this program, but they have to work at least 25 hours on average a week. It's hard to know looking forward who is going to work 25 hours a week. The key is at the time of a claim, just like under FMLA, that's when you look back and you say, who has worked 1,250 hours? That person is eligible. Anybody who is hired by an employer, and those terms and the arrangements and the conditions of that hiring are such that that person was only supposed to work for the summer. Say you hire a high school or a college kid to come in and do your filings during the summer. That kid ain't working 12 months for you. So you would put them on a waiver. And that, if you do a waiver, and again, that's covered probably better in another setting than this one, because there's a lot of information about waivers, but waivers are great. It reduces the cost to the employer. And if you fill out a waiver, what you're doing is you're waiving contributions for that employee. You don't have to pay contributions for that employee. And that employee may actually be eligible for benefits based upon their actual hours and wages. So even though they're on waivers, they have to still be included on the quarterly hour and wage report. Again, contract workers don't even have to be on the hour and wage report, but all of your regular employees must be on your hour and wage report. And our system will help you track these things.
Oh, great information. Thank you so much. Another question, what steps do physician practices need to take now to ensure compliance by January 1?
Right. So starting January 1st of 2025, so earlier this year, that's when it became required that employers with more than 10 Delaware-based eligible employees start submitting contributions. Those of you who use a payroll company or who use HR software have probably gotten prompts from your compliance assistant. That's really what you pay them for, is compliance. And they've been probably saying you should be signing up for Delaware Paid Leave. If you are not using HR software, or if you're managing your payroll on your own, there's still plenty of time. For all of 2025, so all the quarterly reportings of the hour and wage reports and the submissions of contributions for all of 2025, any late submissions, penalties and interest are waived, because this year is all about ensuring everybody understands how to use the program and to join the program. So if you haven't joined yet, you have to come to Delaware Paid Leave, enroll, register in the program, and you can join the public plan, which is the insurance company that the state of Delaware is creating, which the Division of Paid Leave is managing. You may also, if you wish, purchase private insurance through Aetna, through Mutual of Omaha, there's over 15 insurance companies that have been approved to provide group PFML insurance programs in the state of Delaware. It's the Delaware Department of Insurance has been making sure that those insurance policies are up to snuff. Right now, if you come to us and register, you can just basically say, we have purchased a private insurance program. It's technically an application process, but really what we're trying to make sure is that you've purchased a Department of Insurance approved policy, and that your declaration page lists your legal name and your FEIN, and if you have subsidiaries, all of those properly, so that there will be fewer claims issues down the road. And really, that's the main thing. And if you do that by December 1st, then you'll be able to use a private insurance plan instead of joining the public plan, which I have largely been focusing here in this discussion on the public plan and our administrative processes.
Great, thank you very much. There are the questions in the chat. Dr. Kushner, I'll turn it back to you.
Okay, well, thank you, Chris, and thank you everyone who attended this important hot topic session. And a special thank you to Chris Counihan for a highly informative presentation on our current paid leave program. I want everyone to have a good Thanksgiving and enjoy the night. Thank you for joining us tonight. And again,
one quick thing.
Yes.
If you guys are interested, so you see my name, it says Christopher Counihan. If you put a dot between the Christopher and the Counihan, and then an delaware.gov. That's my email address. If you have any questions, Christopher.Counihan@delaware.gov.
Great. Thank you very much. Thanks, everybody.